afternoon, everyone, and it is literally afternoon right now. And welcome to the latest event from the Center for Urban and Regional Analysis here at Ohio State. I am Harvey Miller, and I direct the center, also with Katie Phillips, our outreach coordinator, and in back, Adam Poor, our GIS project manager. We all welcome you to today's event on urban air quality. This is part of a themed events we're having this semester. We're also having another speaker on, where is she? There it is, October 4th. Dr. Michelle Bell from Yale University will be speaking here, a world-renowned expert in air quality and impacts and the social dimensions of air quality issues. So please come back for that. We also have other events this semester. I just want to point out a few of them. We have our Coffee with Cura event. We usually hold these on Thursday mornings. If you're looking for a quick caffeine fix and carbohydrates and sugar and lots of great conversations surrounding cities and GIS and solving the world's problems with GIS. Come by. Again, that's October 10th, November 7th, and December 5th. We do that once a month during the semester. It's just an open house to come by and just take some time to talk about things and identify projects perhaps and collaborations, or just talk actually. We also have a couple of workshops this semester on October 8th. Introduction to Web Mapping with ArcGIS Online, and on November 5th, GIS and Spatial Analysis at Ohio State. Is there an app for that? Two other events I want to highlight. November 13th is the most wonderful day of the year. It is GIS Day, and we're having a GIS Day celebration as we do every year with OSU libraries, and who else is involved in that usually? And the Geography Department, of course, our hosts for Cura's hosts. So that'll be November 13th in Research Conference, correct? And also November 15th, this is a rescheduled event from last year that was canceled due to a blizzard. Our speaker couldn't get here. Dr. Noreen McDonald from University of North Carolina at Chapel Hill will be speaking on healthcare transportation services, how to use IT to improve access to healthcare using new mobility services. So I welcome you to all those events. Check more details at our website, cura.osu.edu. Also like us on Facebook, follow us on Twitter, OSU Cura, and we're now on Instagram. Hey, we're hip now. So what's our Instagram? Cura OSU on Instagram. So follow us on the gram. So now I'll introduce our illustrious panel, and I do mean that sincerely. This is a real who's who of people working locally on air quality, both on campus and off campus. And I'm going to introduce, that'll be the order of speakers, in alphabetical order. And each speaker will have about a 5-minute kind of introduction, overview, and then we'll start the interactivity, the discussions, and the Q&A. So to make these introductions really brief, I could go on for a long time each one of these people, but you'll just have to trust me, they're all completely awesome. Kerry Ard is a professor in the School of Environmental and Natural Resources here at The Ohio State University, and her research explores how social processes create and sustain environmental inequalities by race and class, and how these unequal exposures are linked to health disparities. We have I.S. Hyder, who's an honorary member of Cura since he spent so much time in our facility. We're giving him his own cubicle and a coffee cup. Dr. Hyder is an assistant professor in the Division of Environmental Health Sciences at the College of Public Health, and he's also an affiliated faculty in the Translational Data Analytics Institute. And he received his PhD in biology at McGill University, where he developed and validated agent-based models for the spatial spread of influenza. And Dr. Hyder works on computational public health science. Would that be a good, quick label for what you're doing? Both data and computational intensive work. Carolyn Watkins is the chief of the Office of Environmental Education and administrator of the diesel emissions reduction programs at the Ohio Environmental Protection Agency. She serves as chief of Ohio's EPA Office of Environmental Education and administrator of the Alternative Fuel Vehicle Conversion Grants. And she oversees $20 million annually in state and federal grants to educate Ohio residents about environmental issues, to encourage transitions to alternative fuels, and reduce emissions from diesel school and transit buses and other vehicles in our transportation system. And last but certainly not least is Brooke White, who is a senior air quality specialist at the Mid-Ohio Regional Planning Commission, also one of our good friends here in Cura. Dr. Brooke White serves as Senior Air Quality Specialist for a 15-county region associated with MORPC, the Mid-Ohio Regional Planning Commission. Her portfolio includes educational marketing and outreach initiatives and technical services in energy and air quality. So you can see this is really a fantastic panel to discuss this issue of urban air quality and its impacts. So we'll start with Dr. Ard. Yeah, go ahead. Yeah, please. No.
Hi, everyone. So we were asked to spend about 5 minutes talking about our unique perspective. And as a sociologist, that means that I need to talk to you about how I was socialized to become an environmental sociologist. So I grew up in Worthington, Ohio, and I used to think that the environment was beautiful scenic nature, cute animals, and I find that a lot of 18, 19-year-olds are very similar as I was, thinking about nature in this way. When I was 18, I left Columbus and went to go study zoology in San Francisco. So I got to save animals that were abused, cuddle cute little furry wildlife. I also worked at the Marine Mammal Center and used to help seals. So one day we had a seal that came in that was dead. It had been shot. We were asked to try to get the bullet out of its spinal column in order to submit it to the federal government in hopes of matching this bullet with the perpetrator and prosecuting them under the Marine Mammal Protection Act. 18-year-old me could not understand why somebody would shoot a seal. But as I started learning in my courses, the algal blooms at the time was making it very hard to be a fisherman. And it became understandable how fishermen would think that seals were protecting or were attacking their catches, were preventing them from succeeding at their livelihood. So I started to become more aware of the fact that our environment and society are a lot more complicated than I thought they were. I also, as an animal care and control officer, as an animal cop, I would go to different parts of the city that I wasn't normally going to, such as Bayview, Hunters Point, public housing. And I found that on this side of the city, things were a lot different, right? So there was a lot more African Americans than I was used to seeing in Worthington, Ohio. There was also a lot more industrial sites. And so this is a picture of me at a Superfund site. I had an artistic boyfriend at the time, right? So he would often take photos like this. But it was on this day that I walked outside of the Superfund site, and knowing from my classes what type of toxins were coming from this place, I saw these older African American men. These aren't them, obviously, but this is kind of the scenery. That were just hanging out, doing, chatting, drinking, playing chess, and I couldn't understand why they were so at ease. I knew about all the air toxins, and then why didn't they leave, right? Why were they still there? And as I understood more and learned more about environmental justice, which is called now often environmental inequality, which is the unequal distribution of environmental harms and benefits across different socioeconomic groups. So this is a map of Columbus. The green dots are African Americans living in Columbus. The blue dots are whites. And you can see that our communities are very segregated by race, very segregated by class. And this is very typical of cities. You can look at maps across all of the United States and see this. And my research showed that on average, African Americans are twice as exposed to industrial toxins over time as white communities, and that's persistent over time. So I started thinking about the environment more like this, about what we are exposed to every day, and the health implications for that. So I began researching a little bit more. This is a hotspot map of industrial air toxins in Ohio, and so I started researching this and have continued to try to understand the social and political processes that maintain these inequalities. That's me.
That's great. Thank you. Dr. Hyder.
Oh, let me turn mine on.
me again if the question we're supposed to be answering.
Air quality or air quality is impacts on health,
Okay. All right.
quality, social quality.
Okay.
What do you do about it?
All right. I just want to make sure of that. So I'll talk a little bit about actually a paper that I'm writing with Andrew May, my co-PI on a grant we have from the NSF. And writing this paper allowed me to really think about what translational data analytics means in the context of environmental health. So as Harvey mentioned, a lot of the things that I do are around data, but as someone who sits in the College of Public Health, I think we think about translation and analytics in a very different way. So there are three things that came out of a project that I'll talk about very briefly, and then I'll talk about the three lessons that we learned from that, and then I'll talk about where we're going next in that project, just to give you an idea of how I think about air quality. In the past, I've done work during my postdoc with Michelle Bell. I did work on air quality and birth outcomes, specifically using satellite data. But since then, I've moved on to not really focus on the epidemiological side of things, but more on the translation and the data analytics side. So this one project that we have in the city of Hilliard, we're working to deploy low-cost air quality sensors in partnership with students in the Hilliard City School District. And what they're doing is that they're putting together the sensors with instructions that we've given them. These sensors are measuring traffic-related air toxicants, primarily PM10, PM2.5, that's particulate matter of 2.5 microns in a certain range. And so those are the kinds of particles that go inside your lungs, and they can cause inflammation. So these are the things that can get stuck in your alveoli if you're a biologist and you're interested in that. But these are the things that can also exacerbate someone's asthma. So someone who's at risk of asthma, or an older individual who has lung issues, these are the kinds of particles that can really affect them and their health and their well-being on a daily basis. And so we're also measuring things like nitrogen oxide, ozone, and sulfur dioxide. And so these sensors are being used to measure air quality at a very local level. And then on top of that, we're also visualizing the data by sending it into the cloud. And then we're working with the city school district to develop curriculum materials. So those are that's the project in gist. What this project meant and what it took to get this off the ground was really a collaboration between the silos that exist sometimes at Ohio State or any other large organization, where in public health I had to go meet with the environmental engineering department in order to facilitate this kind of partnership. And it's been a really successful one because the engineering side, Dr. Andrew May, he really did a good job of explaining that part of it, and I was able to explain the public health aspects and the exposure assessment and where to address what schools to target based on the socioeconomic makeup of around those schools as we were deploying these sensors. And then the last thing was that this kind of academic community engagement was really only possible when we were able to show the value of that kind of translation to the community. So outreach activities in the local newspapers and reports in the media about it, and just giving that data back to the community was very impactful. So I'll stop there, and then I'm sure we'll have time.
Kerry, please.
Thank you. So as the bureaucrat and the grandmother on the panel, I get to give you the historical perspective. And a nice smoggy picture of Cincinnati. So the good news is that we have a lot of good news to share and a lot of things to celebrate because things have really, really improved in the last 40 years. And some of us, very few people in this room, but some of us are old enough to remember Steubenville had the worst air quality in the nation back in the 70s. They had a lot of chemical industry, a lot of steel industry, a lot of uncontrolled emissions, and they were unfortunately also victims of their geography. Down in the Ohio River Valley, you would get stagnant air masses in the summer, and that air would just hang there with all of that pollution in it. And so we have ozone alerts today. I'm sure you've heard of some. They're kind of wimpy compared to what we used to have to do in Steubenville. We used to have to close the schools, get the major emitters to shut down business, tell people not to go outside and try not to breathe if you don't have to. It was that bad, literally. I mean, everything you've heard about the London fogs of the 1800s, this is what we had in Steubenville. Fortunately, as I say, the rest of the state wasn't that bad, but we've seen some tremendous benefits since then. And of course, a lot of pollution laws have taken effect since then. This is old data in the brown chart from our agency's 40th anniversary. We've been working very, very hard on updating the trend lines, and we have some new data that has just come out that will be posted on the agency webpage in the next couple of days, literally. I mean, they created these graphs after I put my slides together, and they're big, messy bar charts that wouldn't look good. You wouldn't be able to tell much from a slide. So I did bring some copies if anybody wants those, but just a couple of general things about how much things have improved. Ozone is down 25%, which since 1996. That doesn't sound like much, but the precursors, we've got a 66% decrease in volatile organic compounds and nitrogen oxide emissions over that time. Fine particulates are down since 2001 by 28% or 51% for the 24-hour. Sulfur dioxide down 76%, and that's due to a 91% reduction in emissions. Now that reflects trends where old coal-fired power plants are closing or switching to natural gas or other fuels. A lot of big picture economic trends that are driving some of that. But if anybody wants to go really into the weeds on this data, I did bring some paper copies, and it will be on the agency website and a new dashboard probably early next week. So one of the best places to go for real-time data is the Air Now website. And when I put this in the slides on Tuesday, I was so excited because Ohio was all green. We had really good air quality that day. I pulled it up this morning. If you pull it up now, you'll see some yellow blobs on there where instead of good air quality, we have some moderate up in Cleveland and a little bit down in Cincinnati. And that just shows, because we've done such a good job overall in bringing things down, these are very sensitive to weather patterns moving through, as we have, and of course to things like traffic, all of those kinds of things. But still, overall, we are so much better off than we were. So one of the things that we've done, we're excited to declare victory in a couple of ways. Just 2 weeks ago, we redesignated Central Ohio counties as in attainment for the 2015 ozone standards. We are the first state in the country to redesignate an area from non-attainment to full attainment and ongoing maintenance for that standard. So we are very excited. We are celebrating that. That is not to say we don't still have work to do on the issue of urban air quality. One of the things that we're doing now, a lot of our big point sources, stationary sources obviously are under a big regulatory regime. We've been trying to do more with non-point sources and with mobile sources. And so some years ago, as the health research data was showing that diesel emissions were more of a health problem than we first realized, we began trying to focus our efforts on that at the same time that US EPA did. And so we began devoting some of the civil penalties we collect for pollution violations to some grants. The director asked me, because I was already running a grant program that gives money to schools for science supplies, if I would give money to schools for school buses. And yes, director, of course. And so 3,600 school buses later, and having learned how to crawl under them and photograph parts of their mufflers, we did a really good job on that, but what we started with, if you're a US EPA and you want to bring down diesel emissions, and you know that school buses are where you want to start because the kids are the most vulnerable to that population. They breathe at a faster rate, pollution goes more deeply in their lungs, and there are some appalling national standards for our data that some kids are spending more than 2 hours a day on a school bus. So US EPA started there, we started there. The first thing US EPA did, since you can't wave a magic wand and buy new school buses for everybody all at once, they said, let's switch the standard diesel fuel to ultra-low sulfur diesel. And by removing the sulfur greatly from the national standard diesel fuel, you get almost a 10% reduction in emissions. So they did that first. When they put that in place, a little thing called Hurricane Katrina happened, hit some of the oil refineries, and they had to delay it by about 6 months, but that alone helped a lot. That was also something you had to do because when you start putting the current generation of air emission controls on school buses, the sulfur in that old diesel fuel would gunk them up. So you're spending all this money on expensive new equipment, and you're going to destroy it with dirty old fuel. So you had to do that first. Then US EPA mandated that the new school buses would have a lot of these emission controls enhanced on them, beginning with the 2006 and the 2009 model years. So we know that over time, as school districts retire buses, things will get a lot cleaner. The problem was the middle-aged school buses. Some of them are so old, they're going to fall apart. The highway patrol is going to say, you can't run this bus anymore, it's too rusted out on the bottom, whatever. So we were trying to put idle reduction and emission controls on the middle-aged buses that would still be on the road for at least another 5 years. So we used a lot of state money on that, and then US EPA threw some money in. We got some stimulus money, which really upped the bureaucracy and the reporting and everything, but we did a lot of good, and we did those 3,600 school buses. So turning to some other sources, with the diesel pollution, you're primarily looking at trying to reduce fine particulate matter. Those are the very small, if a human hair is 60 microns, you've got PM10, which were the bigger particles we worked on to start with, and then as we knew more about what goes deeply into your lungs, switched to PM 2.5, and we started with the school buses, as I said, and moved from there. Since we've done all the middle-aged school buses, and now they're getting old enough to be retiring, we're now using both US EPA funding, our state funding, and some funding from a very bad company called Volkswagen, who managed to give us $75 million in penalties because of turning off air emissions in their vehicles and lying about it. So we're able to use those funding sources to do a lot of other kinds of things now. So what we've been focusing on, particularly to focus on using those funds in the areas of the state that have historically suffered disproportionately from the pollutants in diesel exhaust. So we are doing school buses and we are doing transit buses. We do not dictate which fuel a school district may or may not be able to afford to switch. A lot of school districts can do a switch to propane, but they can't afford to put in a whole funding system. The funding infrastructure, fueling infrastructure is not in place for CNG. It requires a lot of real estate, and they don't necessarily have that room around their bus garages. If you know where the Fort Hays bus garage is for Columbus Public Schools, right over here off 71, there is no space there for any kind of fueling infrastructure beyond what they currently have. So fleet owners make their own choices about what fuel they want to use going forward. And we allow new clean diesel, which is far cleaner than old, propane, CNG, electric, and hydrogen fuel cells. We've even funded the first hydrogen fuel cell buses for the Stark Regional Transit Authority. So working on those, we're trying to focus on retrofitting, particularly in the truck category, the trucks that are working day to day in neighborhoods with a lot of starts and stops. So we talk to the big package distribution companies. They want us to fund their 18-wheelers that are out running between cities. We're like, no, we want to fund your step vans that are operating in neighborhoods. The same thing, the waste companies have been coming in, upgrading a lot of their package trucks, their garbage collection trucks and recycling trucks to run on CNG. And so we're getting some good emission reductions there. And even things like the beverage delivery trucks that are running around refilling all of the pop machines all over the place. and refilling restaurants and so forth. Those we can get a lot of emission reductions on. We're also doing airport ground support equipment. We're doing switcher locomotives. Each state has to spend the money within its borders, so we cannot fund locomotives running coast to coast. We're running the ones that are little locomotives that operate in our huge rail yards, putting trains together. When cars are coming off the assembly line, they end up putting them onto new cars, and then they put trains together. So they sit there for a lot of the time idling and really spewing stuff. So we're doing some switcher locomotives, and my personal favorite project lately has been tugboats. We find, and if you look at the picture in the lower left, you will see that they are operating right near residential neighborhoods, very, very close to residences. We got a wonderful proposal from a very forward-looking company in Cleveland to retire 8 ancient, and when I say ancient, I mean these went in the water in 1897, not 1997. They've been out there operating. Their engines were last rebuilt in the 1950s. Diesel engines, tugboats in freshwater last a long time. Now the 1950s, in addition to being before I was born, was way before the Clean Air Act. So these are uncontrolled emissions, very, very dirty. We've worked out a very creative package of funding to retire 8 ancient, old, polluting tugboats operating in our Lake Erie harbors in Cleveland, in Toledo, Conneaut, and Ashtabula. We're retiring them, replacing them with 4 new tugs that are actually smaller, way more efficient, diesel-electric hybrid tugs. And a tugboat is a lot like a switcher locomotive. It spends a lot of time sitting around idling, waiting for ships. Most of the time now they are running on their electric and hardly ever engaging their big diesel engines except when they're actually towing a ship. So we are getting 400 tons a year of emission reductions just from this one project. And my other favorite part of the project is that we got special permission because all of these programs are cash for clunkers. You have to destroy the old vehicle, the old engine. You can't take a school bus and sell it to Mexico so it goes and pollutes the air for somebody else's children to breathe. Well, the tugboats, we got special permission. One of them, instead of destroying it, we recycled it into an exhibit in Toledo at the National Museum of the Great Lakes. So at Ohio EPA, we even recycle tugboats.
Great, and last but not least.
Okay, is it on? Yeah. So yeah, in terms of my own particular personal perspective that I'm bringing to this topic, it's kind of thinking as Kerry was talking about the arc of her career. I think what has struck me most about working where I do right now is that in the past I've been, my training is in the physical sciences. So when I first started out in undergraduate, I was doing physics and astronomy. So I was spending nights at telescopes all alone staring up at the stars, which was beautiful and wonderful. But after that, I realized that I wanted to do something more Earth-focused, something that had more impact on the people around me. And so I ended up switching over to Earth sciences and thinking about the environment, doing research on the Great Lakes and climate change impacts on the Great Lakes. And now, in my current role at the Mid-Ohio Regional Planning Commission, I'm actually working with the public on air quality. And so I'm actually out there talking to people who are using some of our products, like air quality alerts, which I'll mention a bit more later, and realizing why this is important to them. So talking to people like a father who's had a premature infant who checks the air quality every day to take care of his child, a woman with COPD who has issues breathing all the time, so she has to check the air quality on AirNo all the time. And also really positive stories, like a woman who knew that driving for Uber was having an impact on the environment, so she actually chose to go out and buy an EV and helped reduce emissions. So I think that arc from having a very solitary sort of career to having one that's very public, that involves thinking about how I'm messaging and how I'm being clear and using simple language, has informed a lot of my perspective on air quality. So it's very public facing. So yeah, I do work for the Mid-Ohio Regional Planning Commission. We're a regional council of 70 local governments. So I have that focus to my work. We're both a nonprofit and a government entity. So I support them in their own mission to reduce air pollution emissions in their different regions. But because we are also the group that does air quality forecasting and air quality alerts as well, that's a lot of my focus, so that's what makes my job so public facing, is I'm out there trying to get people to sign up for air quality alerts so that more people are aware. And one of the things that's wonderful about Morphe in terms of working on air quality is that we also work on some of the main sources of air pollution. So we work on transportation. We have groups that are trying to drive mode shifts, so that's getting people to consider other ways of getting around town other than just driving alone. We have, we've worked on the C-Pass program, so that's a program that helps fund, it's a public-private partnership that helps to fund bus passes for downtown workers. So we have more people using the bus, really helping to reduce air pollution. We have Ohio Commute, there's staff in here today that works in that program. So that's an incentivization program to try to get people to consider, again, other ways of getting around. Are they biking, are they walking? Trying to find ways to really incentivize that. We also have an energy planner who works on trying to consider what our energy mix in the future should look like. How can we shift away from fossil fuels and incorporate more renewable energy? So the Franklin County Energy Study is absolutely fascinating to look at, to think about where are we getting our energy from, how is it burdening different populations throughout the region in terms of the cost of energy, really burdening certain households. How can we improve that, and how can we improve the mix just for everybody's health? So it's really fascinating to be able to work in the midst of everybody else kind of affecting what I'm doing as well. And in terms of putting out air quality alerts, we basically have two different goals. One is to drive behavior change to protect people's health. So get them signed up for air quality alerts and try to message around how should they behave when there's an air quality alert? What should they do to reduce their exposure? So working in that space it's working directly with the public, but it's also thinking about how can we work with healthcare professionals? How can we have them messaging to their patients so that if they have somebody coming in and presenting with asthma, can they share a leaflet on air quality and how to react to an air quality alert? Then the other side is trying to drive behavior change to reduce emissions. So that's working with my fellow staff on various programs like Ohio Commute. We work hand in hand on that. And so, as Carolyn was mentioning, there are less air quality alerts that I have to put out these days, which makes it a little bit quieter. And given the fact that I'm in a planning agency, it gives me time to think about the future, because that's what, I'm actually not a planner, but everybody around me is, so they're all planning for the future, putting out plans. So I start thinking about the same thing. I start wondering about what is the importance of what I'm doing right now for the future. And I think about some of the uncertainty in the landscape. I think about the possibility of policies changing and us possibly being exposed to more emissions. I think about the impacts of things like climate change. I think about the impacts of the increasing population that we're expecting here in central Ohio and how many more cars we're going to have on our roadways. So I tend to think in that context in terms of trying to get people signed up now to be able to move forward on a better foot. Yeah.
Great. Can we grab one of the microphones, because I'll be using it and also going to the audience, so I'll let the rest of you to share kindly. Okay, so let me start with a question or two. First of all, I wonder if you could talk about, I mean, just to give the audience a general impression of this, what are some of the healthcare or health outcome impacts that you see from air quality? And what are the social disparities in that? You can talk either locally, nationally, or even globally would be fine. If you want to jump in with that question. I mean, what are the big health impacts we're seeing, and who's impacted by that? You're the public health guys.
Yeah, I'll just be very brief about that. I teach a class on current issues in global environmental health this morning, and so this morning's lecture was on environmental health disparities, and the way I explain to them is, who does it affect? Well, try holding your breath. if you cannot hold your breath, then it affects you, right? So what some of the latest research has been showing is that even at levels of some of these air toxicants, the exposures that we thought were safe, really, really low levels, now we're seeing that it's actually not safe. So particulate matter 2.5 is an example of that, where we thought, at certain levels, pregnant women were safe, but no, the latest research is showing that even at those levels, at the population scale, the impacts are they're not negligible. Air pollution particularly affects children, older adults, and those with other comorbidities. And there have been a number of studies that have now started to look at the relationship between air pollution and suicide, air pollution and mental health, air pollution and Alzheimer's, air pollution and urban green space, and some of those issues. So it's
autism too, I understand. They found a link between air quality and
Yes.
Autism at birth.
Right, yeah, and obesity and walkability and diabetes. So these are all really complicated issues, and healthcare systems. Nationwide Children's Hospital has a program where a doctor can actually write you a prescription for an environmental assessment of your household. And so someone from Nationwide Children's will go to your house of a child and do an assessment. You need a new air conditioner, you need your floors changed. They'll work with the landlord, they'll try to get funding for that, because what that's doing is that it's putting money back into it's reducing the emergency measures, the emergency department visits for an asthmatic child. And here's the secret: that is a measure that Medicare uses to pay hospitals more money if they reduce their measures of people coming in with an asthma attack, children coming in with the asthma attack. So the healthcare industry is starting to take notice of these things and saying, hey, we need to address people's environmental exposures in order to get that benefit as well, which is a win-win for everybody. But
What about the social disparities?
Yeah, I was about to weigh in on that. Certainly, air pollution affects everyone. But, there are some historical reasons why certain areas are much more likely to be influenced by industrial air toxins, as well as air pollution from mobile vehicles. So the segregated communities oftentimes have been isolated, African American communities and low-income communities and other communities of color, into areas that are the least desirable. Are those areas that are more likely to be zoned industry and more likely to be rezoned as industry. Highways have been used to separate communities. So as you saw on the map of Columbus, you saw 71 go right through Columbus, right? There are oftentimes these kind of very physical barriers that separate communities, and they're more likely to be in low-income and poor and minority communities. I was just going to say about the health effects. Infant mortality amongst African Americans is severe in Columbus. I think we have maybe infant one, or there we have some Celebrate One, thanks.
Yeah.
Celebrate One, thanks. Yeah, so Columbus has some programs to address these things. But a lot of the health disparities in African American communities, is what I study most, can be attributed back to these unequal exposures. In addition, there's been some research looking at the interaction of stress with air toxins. So when we feel stress, our heart beats faster, we breathe faster. That obviously increases our intake of air toxins, but then the long-term implications of that over time is something that people have been looking at and showing that the stress that comes with being low income as interacting with these air toxins to make it worse. So.
I think.
Well, start thinking of your questions, and we'll turn over to the audience after this response. So if you have any questions, so.
So one thing that I wanted to share that struck me, I was reading about a study that had been done in Los Angeles, and I think we often think of the impact of air quality as being somewhat temporary. Maybe somebody is in an area where there's a wildfire, it affects them for a little while, it goes away. But clearly in terms of things like infant mortality, premature birth, and then also reducing lung function. So they actually did a study in Los Angeles, which has historically had very poor air quality, continues to struggle a lot with air quality, but has gotten significantly better as it has across the United States. And they looked at lung function in children, in a large cohort of children in the, I think it was in the 1990s. And they tracked those children, and they tracked them when they left, if they left and moved away, to see if their lung function improved. And it didn't. They maintained that decreased lung function for the entirety of their lives when they tested them again. But then they followed a new cohort of children in the 2000s, and they saw improved lung function that came along with the improved air quality that the region had experienced. And they tracked those children to see if they moved away to other areas of the country, and they maintained that improved lung function still throughout their lives. So I thought that was very fascinating.
So it's not like getting sick, it's more like an injury that is cumulative. Is that how you would describe it?
Yeah, I mean, it's a part of the development of the child, right? I mean, I can speak from.
Questions from the audience? If not, I have a few more, but we'll give the audience a chance. Yeah, here, let me bring the mic over to you.
We talked about reducing emissions. Are there any environmental interventions that can decrease or remove particulate matter, thinking of green space, trees, ecology? Also, I'm medical director of the Asthma Express program that goes into homes. And one of our successes has been in going into schools and our school-based asthma programs trying to maintain. Has anyone looked at school environments and particulate matter and exposures there?
Responses?
A lot of different efforts underway on this. Reducing idling. A lot of school districts have now changed their policies on how long drivers are allowed to run the engines. And we've been funding technology that keeps the bus warm in the winter so they don't have to run it while they're out at stops. But we're working now, got some great projects with Cleveland. High school students are going out and talking to the parents. The school buses have limits on how long they can idle. Talking to all the parents at the schools waiting to pick the kids up, and they're all sitting there with their car engines idling. So having the kids shame the adults seems to be a good strategy, seems to be working. A lot of other kinds of things that we're trying to do, just reducing traffic congestion generally, a lot of those issues that we're trying to do. I'm going to turn it over to my colleagues.
So I know IS has done some work with kids, but I was a part of a study in Michigan looking at how industrial air toxins related to educational assessment tests, and there was a strong linear relationship between estimated exposure to air toxins and the school's educational assessment tests. In the direction you would expect.
Something that I was thinking about when you mentioned environmental things that you could do to try to reduce. Something that's really interesting, if you go to the Branch Out Columbus website, you can find a map there of tree cover in all the different neighborhoods across the city of Columbus. And that's another space where you see disparity and inequity. You see that the percentage of tree cover often tracks with the socioeconomic status of the neighborhood. So that's an interesting issue, and I think one that the city is thinking about how to address at this point. Similarly to what Carolyn was talking about, I ran a program up at a Delaware middle school here. We called it Idle Free Dempsey, and it was addressing the issue of parents idling around the school. We actually had the students go out to the parking lots and sit there and take data on how many cars are idling, for how long, what kind of car are they, an SUV, a sedan. And then they held an idle-free pledge drive, so trying to drive behavior change in the parents, and we would hear stories all the time of the students basically heckling anybody that was idling in the parking lot, which was pretty fun. These these sixth graders running out there. But yeah, I think it really works. And the other thing is that we really got the students to think about what sort of impacts transportation has on health. And they were bringing this information home to their parents, so we end up with a school community that's primed to think about their transportation choices in the future.
We have you want to respond, Dias?
I know.
Okay, we have a question back here.
I have a question for Morpsey. The air quality index is announced on the National Weather Service radio service. And I was wondering, is that a county quality index, or is it a 12 county metro quality air index? And does it change every hour, or is that just for the whole day?
So that is being read down from Ohio EPA's air monitors are where the data is coming from. And so that should be actually, they're carrying, I'm trying to remember if they're carrying the forecast or if they're carrying the nowcast. We did work with them to put in place a partnership this last year, which is brand new. So we've been figuring out all the different ins and outs of that as well, since they have a lot of different communication platforms. We share our forecast with them, and then they put out our air quality alerts whenever we have one. And actually I need to check and make sure whether they're putting out our forecast value or whether it's the Air Now AQI value.
Is that for the county or for the metro area?
So it's for, we put out our forecast for a 4-county area, Franklin, Fairfield, Delaware, and Licking counties. And it is the forecast value actually that's being put out.
Thank you.
Okay, another question back here.
Just to piggyback on going into the schools, have any, I know one of the panelists stated that the programs were in like Hilliard. Are any of these type of programs to make the Black African American communities aware, getting those students involved with, and also promoting them to be more into STEM and things of that sort? So I was just wondering, are you all doing anything in the Black African American schools that are really being affected to, you know, make those students aware and those educators?
So right now, no. The reason that we went with Hilliard, one was because I live in Hilliard. So it was like on my way home, I could meet with the students and so on. But Hilliard is interesting because there is a socioeconomic gradient that stretches from the south of Hilliard, where it's predominantly less lower on the socioeconomic status, and then as you go north in Hilliard, you get a higher median income and some of those other metrics. And so what we wanted to do, and it's completely overlaid with the dot map of racial residential segregation that Kerry showed earlier. We have a STEM component definitely within this project. We have been trying to work with the City of Columbus School District. We haven't had too much success there yet, and one of the things I always stress to the students, because even within Hilliard, there's a large refugee, recent immigrant population, and for them, STEM is one of the things that they're attracted to because of engineering and some of those things, but showing what public health offers has been really challenging. Engineering students are very much like, this is the solution. They like to do the wiring and then the programming, but I always try to stress to them that this is something that's going to give you data back on your community, and one of the benefits of doing that is the school that we're particularly in, they had a student die of an asthma attack, and so it raised the awareness, okay, that air quality is important and these are the health outcomes. We are starting to now partner up with the Translation Data Analytics Institute. They have a summer camp for girls who come from middle schools, and now in the next year we're hoping to partner with them who are predominantly coming from Columbus City schools, and a large number of them are African American and coming from impoverished backgrounds, to say, hey, can you help us build these monitors and then deploy them in your schools, take the information back to your schools, and then educate your peers about the importance of these issues.
Other responses from the panel?
I really appreciate your bringing that up, actually. The work that I did last year in Delaware, no, was not working very much in that community. We have been thinking about what neighborhoods we're doing our outreach to. There's a tool called EJ Screen that you can go on to, and you can look at things like environmental justice indicators, and then also some indicators for pollution exposure. So they have diesel particulate matter, I believe, on there. And so we've been taking that and mapping different neighborhoods throughout the city of Columbus and thinking about what some of the most vulnerable neighborhoods are and trying to think about how we're prioritizing our outreach. And I think something that I realized when you made that comment is that it's very easy to take the easy way out and work with teachers who come to you rather than going out and doing the intentional outreach and really working in the schools that you need to and with the communities that you need to. And at MORPC, we're trying to think more about how we're doing that.
Okay, another question back here?
Hi. So on one hand, I'm hearing from a regulatory and data gathering standpoint that we're collecting information at a county and regional level and saying we are or are not in attainment. And on the other hand, I'm hearing that the science tells us that we know that that information varies from one neighborhood to neighborhood, zip code to zip code. So how do we get those two things in alignment to where regulatory catches up with known science and we're actually measuring that and mandating not only that the county and region be in attainment, but having some attainment and equity and environmental justice neighborhood to neighborhood?
Thank you for that, Scott. So something that I'm really excited about that's coming in the future is there's a very large revolution in terms of technology. So IAS has been talking about low-cost air quality monitors. There are tons of startups popping up all over the place with really quite cheap, like $200 a pop, monitors for particulate matter, some of the best monitors right now. And so everybody's starting to think about how do we use this technology? Is the data that's coming from it good enough? Can we spread these across the city and get a much better idea of the variability of air pollution and air pollution exposure across the city? And I know everybody's really excited about this. I know air quality authorities are figuring out how do they handle this data source, how do they react to it. I'll let Carolyn speak to that, but I'm sitting on 20 of those particulate matter monitors right now, and I'm really excited to work with a working group that I have at the Mid-Ohio Regional Planning Commission to figure out how to develop some programming using those and deploying those. So it'll be a bit of a wild ride because it's kind of a frontier, but I think it'll be a lot of fun and really helpful.
And is that from purpleair.org? Is that where you got those monitors? Do you want to just mention that just real quickly, or I can, what that is?
Yeah, so it's Purple Air, and it's a nice, it's a quality monitor. There's some issues with the data that you have to consider how you're using the monitor, but they have a fantastic map. If you go to their website, you can see across the world all these particulate matter monitors.
All citizens have this.
Yeah, so it's, yeah, so as soon as you put one up, it feeds up to this website. So it's really a great product.
Yeah, I would second that. One of the issues we have is that the data that we have to compile and report back to the feds is used for regulatory purposes, including putting environmental restrictions and permit requirements on a number of industries. And all of the things we're trying to do to move the needle on automobile mobile source traffic. So the data we use has to be very good data, and 50 state legislatures have said on water quality data, only level 3 data collected over here can be used for regulatory purposes. I expect as we're getting more of these low-cost air monitors, we're going to see the same debate. We really encourage teachers and watershed groups and citizens to go out and collect water quality data for themselves as part of the education process and taking ownership of your watershed. we should be doing the same with taking ownership of our neighborhoods and our local air quality. So we strongly encourage that kind of data collection and citizen science, even when we are constrained by what we have to do, the protocols and the very stringent QA/QC that we have to follow. So I think there's room in the world for both.
Okay, a question?
Hi, this question might be mostly for Carolyn, but most bus riders are people of low SES background, socioeconomic status, and people of color. So I was wondering if your main focus is to change the fleet of your buses to run on CNG, because CNG, clean natural gas, emits less CO2 than coal, but it has a lot of methane output, and fracking occurs in low socioeconomic status neighborhoods as well. So I was just wondering more about why that's your main focus.
Two parts to that answer. First, on a very personal level, I've been a COTA commuter for years. I'm fortunate enough to live in a neighborhood where I have a great, easy commute downtown. And I will tell you that my bus every day is the State Employee Express and Downtown Workers Express. And so I really am impressed with the level of service COTA tries to provide and the number of people who are willing to use COTA. And it's not just serving those underrepresented, underserved populations. There's a lot of effort to try to get more people on the bus every day. In terms of some of the, I'm sorry, the second part of your question?
Go ahead and shout it out.
Yeah, it was just about why we're changing.
Oh, the buses, thank you. Yeah, we are not trying to make decisions for fleet managers on which fuel works for them, because that has a lot to do with what are your mechanics trained to do service on, what fueling source is available to you locally, and what are the prices and competitive stuff. So there are parts of Ohio where it would be almost impossible to have a school bus run on anything but diesel or maybe propane. But we are funding, both for the school bus fleets and the transit bus fleets, we funded 2 hydrogen fuel cell buses. We just gave a grant to COTA for 15 electric buses. We're funding CNG buses, so the fleet owners are making those choices. And we, sitting in our little cubicles in Columbus, are not trying to dictate those fuel decisions, because there's so many factors that a fleet manager has to consider in deciding which fleet, which fuel.
We're going to squeeze in, you want to respond first before we squeeze in one more question? It's up to you. Okay, our final question, sorry if I didn't get to all the questions, but come back on October 4th for Michelle Bell and you can ask her your question.
Thank you. So we've talked about a lot of different policies and programs and wants to change decision-making and consumer behaviors. If you had, and this is for anybody, if you had one policy or regulation or style of heckling or whatever it might be, you had an hour to communicate that to a particular audience on a particular policy or action, who would it be and what would the policy, regulation, incentive be?
Ooh, big one. Okay.
Yes, I have fantasized about this a little bit. So certainly the zoning board, and it's been one of my goals to try to be more active in the local community decision-making apparatus that's here in Columbus, to rethink how we fund our infrastructure and how we are valuing different communities in those decisions. So I don't know, I need a whole hour I would get, huh? I don't know if they listen to me, but anybody else have some?
I really don't know. I really don't know.
It's not one thing you would say?
No, I you know, there's a saying,
Follow the money, right? And so I think there's a lot that can be done if you follow the money. And so the healthcare system is one of the places that I think there, if you can show the value of it, within public health, environmental health is sort of dying. It's not something people are that concerned about too much anymore. And I think we need to go back and show the value of why those things matter. And I think climate change and many of these other things are just gonna make that case for us anyways.
Okay, a quick response from the last two panelists.
I'm somewhat divided between talking to somebody who can affect the ability to electrify everything and somebody who can improve funding for mass transit in Columbus.
I'd like those answers.
There's some folks downtown in the State House I would have some suggestions for, but I'd probably be fired for it. So I will just say anything that we can do to get people out of their cars, thinking about before you sit in the drive-through for your Starbucks or whatever you're doing, think about your behavior, how you contribute and what you can do differently in terms of, I mean, I'm really proud of myself. I took the bus over here today instead of getting a state motor pool car and getting the parking pass and doing all of that. And I don't do that often enough when I come to campus. I need to be sure I'm doing that more often. So all of us looking at our energy use, looking at our behavior and how that affects it.
You did, that's right, you did. Okay, well, that was a great note to end anyway. So join me in thanking this fantastic panel. Again, lots of events this semester, cura.osu.edu, and also there's plenty of food and back, so please take it to go, especially if you're a student. You need dinner tonight, grab some food and enjoy yourselves. Enjoy your weekend the rest of the day.